So people, in this video, let us look at this topic, brainstem death under forensic science. So basically brainstem death is very important because brainstem contains most vital centers. So if these are dead, the brainstem is dead, or the medullary neurons which are if these are dead, it can be assumed that all brain cells are dead. Okay. So this is having this death is like more important than cortical or cerebral brain death. Because if brainstem is dead, it assumes that all brain cells are dead and most of the vital centers are in the brainstem. And the brainstem, whatever is there inside it, the reticular formation, etc., it is required for proper functioning of the cortex. So brain cells, these die within few minutes of stoppage of circulation and respiration. So the first thing that will die if the circulation stops or the respiration stops will be the brainstem. Okay, so brainstem death, we are not talking about brain death here, we are talking about brainstem death. So if the stem goes, then almost everything will go, that's what they are sure of here. Okay, it can be assumed that all brain cells are dead. Diagnosis, and if brain is dead, then it will lead to somatic death. So what are the requisites? So diagnosis of brainstem death, Minnesota criteria. So there is some criteria here. So diagnosis of brainstem death, Minnesota criteria, 1971. So basically Minnesota criteria for brain death, what are the requisites? Prerequisites, a comatose patient on ventilator and positive diagnosis for cause of coma. So irreversible structural damage, core temperature is greater than 32 degrees centigrade. Okay, so all these are prerequisites, preconditions for diagnosis of brain death. The person will be on ventilator, irreversible structural damage, core temperature greater than 32 centigrade. Okay, then what are the criteria? So you looked at the requisites, in that you saw the prerequisites, then you will see now the criteria. Criteria, they are saying irreparable intracranial lesions, no spontaneous movements, absence of brainstem reflexes. We'll come to that. 5 major brainstem reflexes are absent. Apnea. So when you test this person without ventilator for 4 minutes, if you leave him, he will not breathe. Apnea when tested for 4 minutes at a time. Okay. ECG is not mandatory. They are saying here spinal reflex is not important. ECG is not important. They are saying all findings must remain unchanged for 12 hours. For 12 hours, nothing will change. So basically, 5 reflexes of the brainstem will be absent. So which reflexes are these? The pupillary reflex will be absent. Okay. The pupillary reflex will be absent. The corneal reflex will be absent. The corneal reflex is absent. The pupillary reflex is absent. Ciliospinal reflex is absent. Oculovestibular reflexes are absent. No gagging and coughing reflex. This person has no gagging or coughing reflex. So which are the 5 reflexes you should talk about? Which are the 5 reflexes which will be absent? No pupillary reflex to light. So when you put light, the pupil dilation, meiosis, mydriasis not happening. Corneal reflex, blinking, isn't it? Corneal reflex is absent. Ciliospinal reflex will be absent. All 5 should be absent, remember. Ciliospinal reflex will be absent, that is no eye movement. So corneal reflex means no blinking. Pupillary reflex to light, that is mydriasis, meiosis won't be there. Then oculovestibular, that is no grimacing, oculovestibular, no gagging or coughing. Okay. So basically here oculovestibular reflex, basically if you move the head from one side to the other, how will the eyes move, right? So grimacing is like irritant reflex kind of a thing, to pinching, etc. So basically these are the 5 reflexes that will be absent: pupillary reflex, corneal reflex, ciliospinal reflex, oculovestibular, and no gagging, coughing reflex. Okay. Then just look at this. Oculovestibular reflex, they have written one more thing here. No deviation of eyes to irrigation in ear. If you put cold or warm water in the ear, there is no deviation of the eyes. Gag reflex, they are saying no response after stimulation of posterior pharyngeal wall. Pupillary, you have understood, to light. Corneal, no blinking on touching cornea with cotton swab. Ciliospinal reflex, no dilation of bilateral pupil to pain stimulus applied to neck, face, upper trunk. So you're giving them a pain stimulus and no dilation of bilateral pupil. No eye movement is written. Actually, it's pupil dilation only. Pupil dilation only, they're saying. Okay. Then, okay, now let's move on to the classification of brainstem death. Classification of brainstem death. Basically, according to Human Organ Transplantation Act, so there's a classification, certification, not classification. Certification. Okay, certification of brainstem death. So who is going to certify it? Board of medical experts, the treating doctor, the hospital in charge, the neurologist or neurosurgeon, independent medical specialist. Okay. So 4 people, the treating doctor himself, the hospital in charge, a neurologist or a neurosurgeon, and an independent medical specialist. Who should not be present in this? A transplant surgeon, because he will be looking at his own interests, right? He wants the organs. So a transplant surgeon or any doctor in the transplant team should not be certifying that the person is brain dead. Who should check that these reflexes and all? 2 RMPs. Who are RMPs? Registered medical practitioners should be there, and they should perform the test twice. Each of them should perform the test twice, 12 hours apart. Okay. It should not be performed by any junior staff. 2 people, 2 times they should check, 12 hours apart. Each of them should check 2 times. Okay, medico-legal importance of brainstem death. Basically, many countries, including India, legally considers brainstem death as brain death. Okay, so time of death in such cases at which brainstem death is confirmed. This is the time of death. When brainstem death, they are saying time of death. Okay, they'll counsel the relatives in regards to organ donation. They have to counsel. It's mandatory. And if a brain dead patient, the relatives are willing to donate organs, then you should maintain the dead body or the person on ventilator till suitable recipient is available. That's all about brainstem death, guys. See you in the next video. Bye bye.